Welcome to HBOT Journal, a channel dedicated to understanding hyperbaric oxygen therapy through evidence, science, and experience.
When we think about medical devices, we usually picture tools that work on the body, right? Things like a stethoscope, a blood pressure cuff, maybe an IV drip. They monitor you, they deliver something to you, they assist from the outside. But what if a medical device wasn't a tool at all? What if it was an environment, a physical space that you actually enter? Well, that single design difference changes absolutely everything. And in this explainer, we're going to break down exactly why. So this really gets to the heart of the matter, to the core question of this explainer. When is a medical device not a device? At least not in the way we normally think of one. It's a question that pushes us toward a totally different way of thinking about medical technology, one that's built around structure, physics, and a whole lot of control.
And here is that core distinction, side by side. On one hand, you've got your tools. They work on the body from the outside. But on the other hand, you have an environment, like a hyperbaric chamber. It's a space the body physically enters. And look, this isn't just about being bigger. It's a complete fundamental shift in design philosophy. And that shift impacts everything: how these systems are built, how they're operated, and how they're supervised.
Okay, so let's dive into the first and maybe most obvious difference. The chamber itself is a pressure-rated environment. We're not just talking about a big container here. We're talking about a space that has been specifically engineered to manage and control the laws of physics in a really predictable way.
Every single day, all of us exist under what's called ambient pressure. It's that constant, invisible weight of the air all around us. It's the reason we're not just floating off into space. Now, most medical devices work just fine within this normal pressure. A hyperbaric chamber, though, by its very definition, it's designed to intentionally and safely alter that baseline, creating a precisely controlled, pressurized world inside.
So how is that control even possible? Well, it all comes down to some seriously smart engineering. The chamber is a pressure vessel, through and through. Its materials are chosen specifically to handle being pressurized and depressurized over and over again without getting tired. And that cylindrical shape, that's not just for looks. It's actually the best way to spread all those physical forces out evenly. And the seals, well, they have to be perfectly reliable under intense conditions. It's all about predictable structural integrity.
This brings us to another really critical point. You can't just flip a switch on a pressure environment. Unlike a device you can turn on and off in a second, these systems are governed by the laws of physics. They demand gradual, controlled transitions. Time isn't just an inconvenience here, it's a non-negotiable part of safety and control.
And this slide shows that perfectly. Every single session has 3 distinct phases, no exceptions. First, a slow, gradual pressurization to let the body adapt. Second, a planned amount of time at the target pressure. And third, a slow, gradual depressurization to get back to normal. If you rush any of these steps, you lose control and you introduce risk. Simple as that.
All right, on to our second major difference. Because there's a person inside this controlled environment, safety can't just rely on a single component working perfectly. I mean, you can't just cross your fingers and hope for the best. The entire design philosophy has to assume that things can and sometimes will go wrong. And that's exactly why hyperbaric systems are built with layers of predictable control. One safeguard is never, ever enough. And this quote just nails it. Redundancy isn't about making the machine more complicated for the sake of it. It's about making its behavior more predictable. It means if one part fails, there's another system already waiting to take over and maintain control, making sure that environment stays stable and manageable. So what does that actually look like in the real world? Well, a system might have multiple valves to control the pressure, not just one. It'll have digital gauges for incredible precision, but also analog gauges right next to them as a simple physical backup. And then, completely separate from all the primary controls, you've got independent emergency release systems. It is all about creating layers of safety so no single point of failure can ever compromise the entire system.
And that brings us to our third key difference, and this one is all about the human element. This is not a machine you just turn on and walk away from. The relationship between the operator and the chamber is a genuine partnership, where human supervision is actually an integral part of the system itself.
I mean, think about it. A lot of medical procedures are quick: a scan, a measurement, they're over in minutes. But a typical hyperbaric session, we're talking 90 minutes, maybe even longer. That duration fundamentally changes the dynamic. It's not a brief interaction, it's a sustained, shared experience that absolutely requires continuous presence and oversight.
That's why so many of these chambers are transparent.
The clear acrylic isn't just there for comfort, although, it certainly can help with that. Its primary purpose is functional. It allows for constant direct visual monitoring and clear communication between the operator on the outside and the person on the inside. Visibility is an absolutely essential tool for control.
So you might be asking, well, why not just automate the whole thing? This slide explains it perfectly. Machines are fantastic at following instructions, at maintaining a precise pressure or timing a session down to the second. But humans are essential because we interpret context. An operator can see if someone looks uncomfortable, they can understand a nonverbal cue, and they can make a judgment call that a machine, no matter how smart, simply can't.
And this quote just wraps up this whole section perfectly. The chamber isn't just a device being used on someone. It's truly a space being shared by the technology, by the patient, and by the operator, all connected by that shared environment and the need for constant interaction.
Okay, so let's bring all these pieces together now. We've talked about the pressurized environment, we've talked about the redundant controls, and we've talked about the human partnership. When you combine all of them, you start to realize you're not looking at a single object anymore. You're looking at a complete, interconnected system. And here's the crucial point. The hyperbaric system includes all of these elements, and they all have to work together. You've got pressure control, oxygen handling, time planning, human supervision, and all the safety procedures. If you take away any one of these, you don't have a functioning hyperbaric system anymore. It's like having a car without an engine or wheels. The individual parts just can't achieve the goal on their own.
So, to put it all into one final sentence, a hyperbaric chamber is not a device. It's a controlled environment. It's operated through layered, redundant systems that are designed for predictability, and it is always guided by active human oversight. Each part depends on all the others to function safely and correctly. And that brings us to our final and absolutely essential takeaway. Because these are complex systems and not simple objects, their design and how they're used has to match their intended purpose. Different designs exist for different contexts, but all of them require appropriate supervision. So the next time you see a medical device, maybe ask yourself, is it a tool or is it an environment? The answer just might surprise you.
To continue learning, explore the HBOT Journal channel.